Good day, ma'am. I'm Jack Palacial, second year nursing student from Pamantasan, Luzon, Marikina, and I'm going to perform a return demonstration of intradermal injection or skin test for allergies. Why it is necessary? Because we nurses are the one who administer drug to our patient. In that case, we need to assure that our patient doesn't have any allergies from the said drug. The first thing I'm going to do is before I enter the room, first I'm going to perform hand hygiene. So we're going to reduce the risk of transmitting microorganisms. And then next is I'm going to identify the client. And good day, sir. I'm Jaco Lacial, your student nurse for today. Are you Jean Michael Mira? He said yes, and then can you state to me your date of birth? He said January 31, 2000. So, correct patient. The next is, I'm going to provide for the client's privacy throughout the procedure. So my patient will be comfortable throughout the procedure by closing all the doors and the curtains. Then the next is I'm going to assemble all of my necessary equipments, which is the most syringe, 3cc syringe, the drug from the ampule, cotton balls, and the gloves, and also the kamatis. This will act as the skin of the patient. Next is, I'm going to position my client with his arm with his arms are relaxed and his abdomen too. And then next is I'm going to get a syringe. To get the syringe. I'm going to uncap it. And then next is I'm going to withdraw a drug into the ampule. After that, this is sterile, so you're going to use the scoop method, so you won't be contaminate the syringe or the needle. And then next is I'm going to locate the area of or the site that I'm going to inject the drug in the skin of the patient. First you need to use the cotton balls, kamatis, that will act as the skin of the patient. Lapit mo. Imagine that this is the paano mo rin sa akin. Yan. Imagine that this is the skin of the patient. So I'm going to rub it with the cotton balls with alcohol with a circular motion outward. Yan. Then discard. Then next is you're going to locate for the clean site, which is the site that you rub with the alcohol, and then you're going to choose a area that doesn't have any swollen or tenderness or any lesions. Then I'm going to get the syringe with the drug inside. Then you're going to, if there's a bubble, you're going to flick it, so the bubble will go into the top, and then you're going to inject it, so the bubble will go outside. Okay, there you go. And then the next thing you're going to do is you're going to stretch. First you're going to position the syringe with your forearm and your thumb. You're going to place your index finger in the hub of the syringe. Then first is you're going to stretch the skin of your patient, so you're going to be easily to insert the needle. Then after you stretch it, once the skin is stretched, you're going to place the you call this, the bag, the bevel. You're going to place the bevel and then the syringe with the 45 degree, and then insert the bevel into the epidermis to the dermis. After you insert it, you're going to hold the hub with your thumb, so it will not be move, and then you're going to eject it. In my case, it doesn't have any wheel because it is only Comatis. But in the skin of the patient, you need to. It will form wheel. Imagine that there's a wheel in the Comatis, and then next is you're going to do not massage the wheel, and then next is you're going to place the cup into the syringe, and then put the syringe into the sharp containers. Imagine that there's a sharp containers, and then you're going to get a marker. You're going to put a circle in the wheel, and then observe if there's a redness. If there's a redness, your patient has an allergy in the drug. If wala, edi walang allergies. And then you're going to clean all your equipments, and then you're going to document all the necessary data, and then that's all. Thank you.